In this video, I'd like to introduce why the Yamane technique through a temporal approach has unique advantages in eyes with a large white-to-white. Now, for the Yamane technique, you should always look at your printout specifically at the white-to-white, because the three-piece IOL that you use is typically only 13 millimeters long. And so if the white-to-white is very, very large, let's say more than 13.5 millimeters, then this technique is not a good technique for these cases because you don't have enough length to externalize the haptics. But in borderline cases, which I define as around 12.5 millimeters, I do have one strategy to address this issue. And so the strategy is to operate through a temporal approach. When we talk about white-to-white, we're talking about the horizontal corneal diameter. And so let's use a theoretical case of an eye that has a white-to-white of 12 millimeters, that is 12 millimeters across. And when you sit superiorly, then you're operating through that 12 millimeter white-to-white. However, keep in mind that the vertical corneal diameter is on average about 0.8 millimeters shorter. And so by operating temporally, as shown here, the white-to-white is no longer 12, it's actually 11.2. It's because you're specifically operating in this meridian here, and so you have now created a shorter working distance. And that's very, very key for these borderline white-to-white cases. If you try to externalize a three-piece IOL in an eye with a very large white-to-white, you will inadvertently pull on the haptics, and that excessive pulling can cause tilt. By performing the technique on a shorter distance, you're going to induce less tilt, less stretching of the haptics, and less stress on the haptic-optic junction, both in the acute phase and in the long run, because the more the haptics are stretched, there's more stress on the haptic-optic junction. And so if you have a case of a large white-to-white, borderline 12.5 or so, I would recommend the temporal approach for the reasons I've outlined here. Now, I personally perform the temporal approach on all cases, whether in large white-to-whites or in eyes that have normal white-to-white, because by using a smaller working distance, there's less pulling and stretching on the haptics relative to a superior approach. I hope you found this video to be useful, and thanks for watching.